Hello everybody, I'm Doc Christine and today I want to talk about the barrel model of disease. Now first we have to understand what disease really means. Let's look at it from our civilized world view. The diseases of our civilized world that are increasing in frequency are mostly fatigue, brain fog, food allergies, autoimmune diseases, skin problems like allergies or eczema. Now, autism, ADHD, memory problems like Alzheimer's diseases, mental health problems, depression has risen immensely, and of course chronic pain like fibromyalgia and others. Now, what really is the cause? We don't really think about it. Is it because our genes change? Or is it because our environment changed? Or is it just because we get older? Today, I'll give you the answer. In my opinion, and that of many other experts, the three main causes of disease, it's not a Zoloft deficiency, it's not a medication deficiency, it's either inflammation, and there are several causes that can cause inflammation. Either toxins, there's many toxins that influence our health, and nutrient deficiencies. And those causes have subcauses and they interact with each other. What is the barrel model? And is it the genes or the environment? And the truth is, it is both, because our environment interacts with our genes. Now, the genes haven't changed in the last 100 or 200 years. What has changed is the environment and the expression of the genes. We also call that epigenetic. Now imagine everybody, including you, has been born with the barrel of a different size. So that's your genes. Yes, you have genetic disposition to a barrel of a different size. And each barrel that you're born with has a spout that drains the barrel. And that spout is of a different size. And it doesn't always mean that a big barrel has a big spout and a small barrel has a small spout. It can be different. And what does the spout represent? The spout represents our detoxification systems. And our detoxification systems are liver, bile, bowel, kidney, lungs, and skin. And the rain that's filling the barrel represents all the environmental influences. Now let me show you what I think is filling our barrel. What is filling your barrel? There's environmental toxins that have increased within the thousands our exposure to it. There's malabsorption, and that can have different causes. There's inflammation, especially chronic inflammation. If we don't get the movement, it will be filling our barrel. If we have too much stress, relationship problems, toxic thoughts, our barrel gets filled. If our gut microbiome is damaged, it's called dysbiosis, it will fill our barrel. Hormonal imbalances, chemical imbalances, nutrient deficiencies, infections, parasites, viruses, bacteria, chronic infections, of course, smoking, drug abuse, and certain medications can fill our barrel. Now, what does it mean when your barrel gets filled. What it means is that once the barrel is full, and it can take tens and decades to fill the barrel, as soon as it overflows, and in German we call that the drop that made the barrel overflow, we get a spill. And with the disease model, we experience that as symptoms. We get depressed, we get an allergy, we get a heart attack, we get the skin breakouts, we get tired, our brain doesn't function well. And it is a barrel that overflows. And of course, traumatic events like the nail that gets nailed in our barrel can lead to a leaky barrel earlier. Now, what do conventional medicine mostly do? They mop up the spill. They don't contribute to emptying the barrel. So if the exposure stays the same and the spouts are still clogged, it will continue to overflow, and you have to continue taking medications to mop up the spill. Let's go back to the barrel model. Obviously, when you are born with a small barrel with a small spout, the same amount of rain or environmental influences will fill your barrel much faster and cause it to overflow as in somebody that has been born with a big barrel with a big spout. And that explains why there's people that can smoke and dope, eat junk, and live in stress all their lives and still get 100 years old and stay well. They have been born with a big barrel with a big spout. Now, very much more common today is a medium size or small barrel that fills up over years and years and years. And we don't notice nothing. We just think, okay, we are getting older. And suddenly the barrel starts overflowing. We are getting the symptoms. And if we have a small barrel, the symptoms start earlier, even in childhood. Especially if the spout is clogged, which certain environmental influences do. So that's where my barrel model comes in. What we need to do is first assess what is filling your barrel in your case, what is clogging your spouts. The second point, we need to intervene. We need to unclog the spout and reduce the rain. And then we need to maintain that program. I call it the AIM or AIM method. We need to aim to empty the barrel, and we need to aim for better health.